Hello, everyone. Welcome back to Behind the Counters today. For today's episode, we feature Dr. Erin Knox, who is a well versed psychiatric pharmacist and the director of Experiential Pharmacy Education at UCS School of Pharmacy and Pharmaceutical Sciences. Dr. Knox, welcome to the podcast.
Thank you so much for having me here. Happy to be in a conversation with you.
Thank you. So, today we're going to cover some important topics surrounding your journey becoming a psychiatric pharmacist. First of all, we will also go through some tips on how to properly address patients who might have mental health difficulties in a healthcare setting, hoping to provide a better insight to our audience who are either practicing in the pharmacy settings as a pharmacist or are a student who are trying to learn along the way. So, without further ado, let's get this started. So, first of all, Dr. Knox, would you like to describe a little bit about your career journey so far?
So my career journey, really specifically starting with pharmacy, kind of wasn't what I expected. I've always had an interest in psychiatric pharmacy, and I'm sure we can talk about that in more detail. But when I went to pharmacy school, I had intern jobs, so paid positions as an intern pharmacist. And some I liked more than others. One that taught me, oh man, I don't ever want to work in a basement pharmacy with gray walls and no windows. And my first job out of residency was in an acute care facility in a basement pharmacy with gray walls and no windows. And I loved it. So I kind of had this idea about the setting without really realizing how the work I was doing was going to really scratch the itches that I had in my professional life. So I spent a decade and a half working in inpatient doing acute care in a hospital setting. I really didn't envision myself doing critical care, but I loved it. After 14 or so years doing that, I decided I wanted a little bit of a change. And so I took a position at UCI Medical Center as the education specialist. And then I got to go back to inpatient psychiatry and rounds on a regular basis, which was so validating and really exciting to be able to work with that primary psychiatric illness population again. So much of what I did in the critical care setting was psychiatry consults. So patients were medically ill, usually very acutely ill, who also had psychiatric needs. When I started at UCI Medical Center, I got to go back to my kind of core training, which was patients with primary psychiatric conditions who were very acutely ill. So it was a little bit of a pivot. It was still building on a lot of the skills that I had developed, continuing to do things like develop student experiences, work with residents. So I really love the interaction with learners. While I was at UCI Medical Center, this really novel opportunity presented itself at UCI School of Pharmacy. And I took the chance and said, let me do something really unique, something I probably won't have another opportunity to do. And that's to build an experiential program from the ground up. So I get to still work with psychiatry on a more limited basis at UCI Health. But my primary job now is really building up this experiential program for the UCI PharmD students, which is really exciting because I have this vision and all these experiences from my past now 20 years as a pharmacist and can really apply some of the things I've seen that are fantastic and maybe tweak or revise some of the things that I feel like we could be doing better. So it's been an interesting journey. I don't think I'm done. I think there's certainly more in store. And lots of opportunities have presented themselves at UCI School of Pharmacy and Pharmaceutical Sciences. So I've had some unique things that have come across my desk and I've taken them. So the position, although it's experiential education director, it really entails a whole lot more, including some things like working within the school in administrative positions, committees, and then also in my role as a mental health first aid instructor.
Wow, sounds really, really exciting, by the way. Seeing how like the transition between a more of a like a practitioner role to, now you're one of just like administrator or like preparing a new program is like certainly very exciting. And like follow up on this is like at what point of your career did you figure out you want to become a psychiatric pharmacist?
Well, so interestingly, my interest in psych predated my journey in pharmacy. I always had an interest in substances of abuse in psychiatry. My mom was a psychiatric nurse, and I would hear stories and hear about her work. And I thought, wow, that's really interesting. And interesting is just it's such a superficial word. What really struck me was that there was so much context and so much humanity in psychiatry. And so when I look at the benefits of being a psychiatric pharmacist, I have a unique position compared to some other specialties in that I can't ignore the big psychosocial picture, where the patient lives, who they interact with, what their job is. So much of their ability to function is tied to their psychiatric symptoms. And so when you're looking at the care of a patient who has a psychiatric condition, you can't just treat symptoms or just treat a disease state and move on with it. You have to look at the big picture of how are they going to get access to this care? Where do they live? So you get to bring in, as a psychiatric pharmacist, a little bit of that kind of social worker perspective, a little bit of the case manager perspective. You really have to take all of these things into consideration. In addition, you have to talk to your patient. So I love interacting with my patients. I love educating them, talking to them, meeting them where they are, and really being able to do something as simple as take a prescription bottle and teach them how to read the relevant information on there. Because it's so important for a patient, regardless of what condition we're treating, to take an active role in their healthcare. And with psychiatry, especially, sometimes because it's so stigmatized, we think, oh, well, someone else is going to give them their meds or they're not going to be able to do this. But, we have to build them up and teach them. And so this idea that you have to talk to your patient was really what struck me. I certainly recognize that in critical care, I don't get to talk to my patients. And that's why I talk about critical care scratching a very different professional itch than, say, psychiatric patient care. But I love interacting with patients. I love hearing their stories and putting it all together and helping them really formulate the best next step for them. So psychiatry, it's really a little bit different. There's different levels of severity, if you will, when we talk about psychiatric illness. But the underlying theme is you still have to talk to and engage with your patient no matter what. You can't treat them from afar. And so that's why for me, it was always psych. I always wanted to be able to talk to my patients. I love engaging with my patients. So it was always going to be psych regardless of what I ended up choosing.
Yeah, that sounds great. I like how you speak about like the big picture side of things. Considering not only about their healthcare needs of a patient, but also like their social needs and stuff, right? Speaking about, pharmacists being one of the most accessible healthcare provider out there, speaking to a patient is practically a skill that almost all pharmacists should have and able to relate to them in a certain sense, right? Not just maybe, let's say, like, for example, in a community setting, you counsel a patient, but is all you do really just all talk about like how the medication works, or you want to go through like something like more close contact or like able to relate to the patient or like help the patient overall, not just their healthcare needs, right? How does psychiatric pharmacists, the role of psychiatric pharmacists, elevate that level in terms of helping mental health patients out there?
Well, psychiatric pharmacy is a smaller specialty, but it's large enough that we really have this maintained sense of community. And we go into it for a multitude of reasons, and many of us have a variety of hats that we wear. So some might be in clinical practice and academia. Others might work in, more managed care. There's a lot that work in more government, kind of established organizations. But at the core of it, we all recognize that we need to advocate for our patients while maintaining this respect for their autonomy. And so it's a balance that you have to strike. The other part of it is the stigma associated with treating patients with psychiatric illness. They're an underserved population, especially the persistent, chronic, severe mental illness types of patients where, they are very stigmatized Yet broadly looking at psychiatry and mental illness, so many individuals are impacted, whether you as an individual, someone in your family, someone in your community, someone in your small circle likely has been impacted by psychiatric illness at one point or another. And so we're all kind of sharing this idea that mental well-being and mental health is for everyone. And this is what you hear from psychiatric pharmacists. There is a huge movement, lots of grants, lots of support for getting mental health first aid training for our community pharmacists. So pharmacists who are really in the front line in the pharmacies are interacting with individuals who have psychiatric illness or mental illness and have symptoms. So we're doing this big push. I'm involved with many of the training opportunities to ensure that our community pharmacists are getting training in mental health first aid to really be that last line, that accessible healthcare provider that we talk about, but being face to face with these individuals with really many of these skills apply to any individual, even those of us just having a bad day. We can benefit from our community pharmacists having mental health first aid types of skills.
Yeah, sounds amazing. Again, like going back to the point where pharmacist is so accessible, right? Having these skills or having these tools where like a pharmacist can address some basic mental health needs, I think is incredible. Moving on, any particularly interesting experience or projects that you have worked on during like, let's just say, a particular rotation when you're a pharmacy student, or during your residency, or even during your time precepting under a student? Like, is there anything that you really spark, you say like, this is actually like very interesting that what you're working on?
Well, as a student, that was a long time ago. So much of that information is probably dated. And although it was 20 years ago that I did residency, there is actually my residency project is very related to what we've talked about so far today. I did a survey where I sat in the campus pharmacy. So it was the student health and faculty staff pharmacy in the middle of campus. And we did depression screenings. So we did a self-rated depression screening for individuals who were willing to take it. And then afterwards, we evaluated their sense of comfort doing it in this setting. And it was my way of doing a residency project that provided an intersection of my two most prized types of settings at the time. I loved student health center pharmacy. I loved community pharmacy in this kind of smaller pharmacy setting. And I loved psychiatry. So my project was this great intersection. It really hit home for a lot of the students and faculty staff who came through, because there were some high profile psychiatric illness types of situations around campus. And so they said, oh my gosh, yes, everybody needs this. We need to do this. Of course, I'm comfortable talking about this. I come here to buy things for sexual health. I can certainly talk about depression. You're qualified to talk with me about depression. I'm comfortable talking to you about it. And so what we were able to demonstrate in, obviously it was a very specialized type of setting, but the student and faculty staff population was really comfortable engaging in conversations around depression. And, reflecting back on it, there's been a shift in society. People are far more comfortable talking about their own individual experiences. You see this in social media, you see this in everyday interactions. People are far more comfortable. In 2003, when I was doing these surveys, 2004, it certainly was much more novel and people were starting to talk about it. And it was really a good reflection point as I look back that, yeah, things were starting to shift. Society was maybe changing a little bit to become a little more comfortable with some of these things. Now, one of the other things that I consider, though, is my current role and how comfortable some people are and whether or not they're utilizing terms correctly. So that's something that I tend to focus on, that if we're going to talk about mental health, we need to use the proper terminology. We need to use the terms correctly. So when I teach, co-facilitate mental health first aid trainings, we talk about utilizing terms in the correct context, using them with the correct definitions, and making sure we're not throwing them around unnecessarily, because that really doesn't do anyone any favors and can kind of diminish the impact of a really severe or persistently mentally ill patient's experience. So, reflecting back, my residency project was great. It was such a pivotal moment, and hadn't really considered it until we started engaging with this. I don't really think about my residency project every day because it's not my practice setting. But yeah, that was fun. That was a good project.
Wow, sounds great. Again, like I think what you talked about how like the societal shift in between like comfortableness in speaking about mental health, right? I think it's really been seen, and also one of the prime goals of this podcast really again is to really show like we should raise mental health awareness within the realm of pharmacy and healthcare if possible. And I think what you did, what you're doing right now, bridge us well to the next question in terms of if you can provide us some tips on how to properly address patients with mental health difficulties in a healthcare setting. I'm sure that a lot of people would hopefully benefit from this, even myself, because I want to make sure that patients that I address outside are comfortable with me talk about them in a correct terms. So yeah, go ahead.
Sure. So there's a couple of things that come to mind when you think about how to address patients who have mental illness within the healthcare system. And if we think about in a hospital setting, there's going to be considerations from like a case manager type of point of view where it can be more challenging for someone who is currently experiencing a lack of housing or a lack of regular, consistent, and reliable housing, transportation, funds, those sorts of things. So we always have to consider that those things need to be coordinated and can impact our ability to decide on a best course of treatment, for example. But if we're thinking about kind of a more direct or more accessible setting like a community pharmacy, for example, when we talk about individuals experiencing some psychiatric symptoms, those maybe who have mental illness, there's a couple things that come to mind. Number one, this use of person first language. So we don't want to diminish the idea that there is a person first, and it's a person who has either symptoms or mental illness, but we're not putting the mental illness first. So we're not going to say, a schizophrenic, it's more a person with schizophrenia. And that's if we know that that's their diagnosis. So this idea of person first language, because language matters, words matter. We can just say they're just words, but they absolutely matter. So we really want to do our best to put person first language at the forefront of how we discuss individuals. The second thing that comes to mind is if you're interacting with an individual who seems to be experiencing some distressing symptoms, we try not to focus too much on what the symptom is and really shift the emphasis more towards how they're feeling. And that can be by validating what they're feeling. It seems this is very distressing. I understand this seems like a really challenging situation. That kind of validation, it's a little bit of this customer service kind of retail perspective, but validating the experience and validating the feeling is going to get you much more leverage in this conversation than if you spend all your time trying to assess and understand the symptoms. Because oftentimes we're pressed for time. We have limited resources, right? We have limited time, limited ability to engage with someone in a private setting. So validating the feeling that someone is experiencing. And again, that's not just for someone with mental illness. That could also be someone who's having a bad day. But that's going to get you much farther in the conversation and help you to establish rapport. And then I think the last thing is the idea of establishing rapport and showing that you're friendly, open, patient, and that you're someone this individual can trust. Pharmacists being very trustworthy healthcare professionals. By demonstrating that, by showing a little bit of warmth and empathy, you can start to develop the relationship with the individual so they're willing to come back and engage with you, even if they're not really in a space to do it at that moment. So those are kind of the three takeaways for interacting with individuals who might be experiencing symptoms of mental illness during your interaction with them in a community pharmacy.
Yeah, definitely sounds great. I think what you addressed there, right? Especially when you consider like the amount of things that are happening in a community pharmacy. Maybe let's just say, for example, if a patient wasn't able to get their medications, right? For some whatever insurance reasons, whatever thing, right? Just maybe like being able to have the skill to talk to them or speak to them about the issue, and as well like of like what causes them to not being able to like get their medication or something, some healthcare stuff. But also able to understand them or build an empathy to them, right? I think it's very, very important to have a skill as a pharmacist to be able to do that, despite having maybe a lot of hectic setting like prescriptions filling going on, everything's going on, um, and which we'll also address in a later episode with someone I was able to closely interview with, who talked about like community settings, how we can improve the mental health awareness over there. But I think what you just summarized, Dr. Knox, is super useful and super helpful, and I really appreciate all the tips and tricks.
Well, this has been great. I would encourage anyone who's engaged with this recording to consider mental health first aid training if you haven't. QPR training, any of these sorts of trainings will allow you to learn some of the skills, maybe build on skills you already have, but also practice them in a more controlled environment. Just like muscle memory, practice saying these things out loud, practice walking through different scenarios and interacting with, albeit fake scenarios, will provide you kind of a structure and like a skeleton of what you can do moving forward. Plus, we do things like small group discussions where you can practice saying these things and bounce them off and see how they're received amongst your group members. And sometimes something sounds really good in your head, and then you say it out loud and you see people's reaction and go, maybe not. So, these trainings give you this opportunity to practice, to engage, and to really refine those skills so that when you are in a setting that's high stress, high pressure, like a community pharmacy, that you can kind of just rely on that muscle memory. I've done this before. I've been through this. I'm going to practice this right now in this setting.
Well, thank you again for coming to our show, Dr. Knox. Again, to our viewers, hit the like if you enjoyed it. Comment down below on things we have done well and things we can improve on. Click the subscribe and notification bell for our latest content. Go give a follow on our Instagram and Twitter to show us your support. Thank you everyone for watching. We'll see you next week.